welcome to another episode on healthcare of India. So I'm Sukant Khurana. With me is Raamesh, Gowri, Raghavan, Sharath Krishnaswamy, and Dipasri Konar. Dr. Sharath Krishnaswamy is an anesthesiologist and a science communicator. Dr. Dipasri Konar is a microbiologist and a physician who's been trained both in India and in US, and she's currently working in Chhattisgarh among tribal population. Raamesh Raghavan is a co-founder of IonCure, and he's a top advertising professional, an archaeologist, a linguist, and does a variety of other things. He used to be a scientist, and that's how we became friends. And he took a smart decision of getting out of biology research long time back. But he still does, actually. He still knows a lot more than most active scientists, but that's a separate story. So we previously have discussed with Dipasri issues of Chhattisgarh, and we realize that there are multiple Indias. There are, the solutions which are valid for New Delhi are not valid for Chhattisgarh. The solutions which are even valid for New Delhi upper middle class are not valid for migrant people. So Dipasri has enlightened us about the problems people are facing in Chhattisgarh. Just to recap the whole thing, she told us how people were coming back with their tuberculosis with absolutely no medicine, people facing severe starvation issues, just being fed on rice and salt, people actually, facing issues of not getting tested because they don't have travel history. And according to current guidelines, there is no community transmission, while in reality, there is massive community transmission going on. So people can't get tested. And the fact that even though her own hospital has PPE, it is courtesy several donations. Now, if the donations run out, those PPEs can run out, the situation can be different in future. So it's basically COVID-19 has exposed the fault lines, has exposed the weaknesses of Indian healthcare system. I'll get back to Dipasri again and try to sort of understand what do you think are other challenges and how do you think they can be fixing of these issues gradually? Obviously, there's not going to be an overnight magic.
See, healthcare is a social issue. It's a political issue. Not, it's not an isolated issue. So we have to really revise our priorities, and look into it through other perspectives. It's not that what is your, like, when you're thinking of retirement, when you're thinking of savings, what do you save for? I mean, after retirement, what do you save for? What is the maximum expenses that you can think of? It's your health, right?
Mm-hmm.
It's your health. You might or might not have a vacation. You might or might not go for a big house. But if you need healthcare, if you need proper, to get your medicines, to go to your doctor, to get some surgery or whatever, you have to do it. It's life or death. So why are we so casual when it comes to healthcare as a country? Mm-hmm. So even in an institute like ICMR, when there is no good data, as Ravi in the other episode pointed out, there's no good data about HCQ. If you want to promote HCQ, do a randomized control trial. I mean, you cannot just give out regulations like, yes, HCQ works. How do I know it works? Why should I listen to you when there is no data available? Are you accumulating data? If that is the case, then show us the data.
Yeah. They're not even sharing.
No, they're not sharing data. I mean, this attitude of like, I am the boss and I tell everything and everything is right. So it doesn't work that way.
Mm-hmm.
And as I was saying in the first part when we were discussing, why are we not seeing state-wise distribution or district-wise distribution of the COVID cases and mortality from the ICMR? Instead of giving a big roundup, why are we not seeing? Because they have the data. So why are they not sharing it with us? We would like to see it from ICMR because that would be reliable.
Mhm.
So as I said, that COVID is just, it just shows us that how little it takes to push the world to a brink.
Absolutely. And
It's not just India. Even who would have thought that would so poorly? It's not just India. It's
oh,
also USA. It's also Italy. It's also UK. It's France. So as a
yeah.
global community, we have to cannot live in isolation no longer.
Hmm. Absolutely.
So,
So,
so we have to work together and for a common cure, and it's very much possible because the speed at which nobody would have thought that it was even possible. Maybe the last pandemic or the last epidemic, we have had epidemics before,
mhm.
so it's I mean, we think about it. We had 2003, if I'm not wrong. Yeah, we've had
Yeah.
things like Ebola, we've had things like Nipah, but what did we do after that? We know that devastation and
Mhm.
infectious disease can cause. And if it's an airborne
Mhm.
disease, there's practically nothing we can do to stop it. So
Mhm.
what have we done? We did not learn our lessons, and today we are facing this. So
Mhm.
I think, the lessons, and this will increase, the frequency will increase for a number of
Oh,
reasons.
absolutely.
Yeah.
Yeah.
Yeah. So, and
This is the
I
frequency is
mean,
going to increase a lot. Yeah.
yes. So the sooner we learn and the sooner we take care of the loopholes, the better. And if you don't
Absolutely.
provide basic healthcare to the people, if you don't provide basic education, basic food, if there's no food security in the country, then I don't think we'll be
Yeah,
able to fight it.
you can't have healthcare without food security, without employment security, without even elderly monitoring. And there are aspects of even creating smart homes, which may sound like, okay, it's for millionaires, but with cheaper technology, with platforms like Arduino or Raspberry Pi. I know it may sound French and Latin to a lot of people, but with really cheap integrated circuits, you can even have monitoring in individual homes. Right now, you're not even able to, in India, we are not even able to get the trains in the right places. Something which is supposed to reach Bihar is reaching Karnataka. Talking of smart homes sounds like science fiction, but you can build smart homes with decent monitoring at the same price as a cell phone. So future is possible if there is a political will, and I completely agree with you, Dipasri. Healthcare is political. Healthcare is a social issue. It's also a cultural issue. How easily we believe in fake news, how easily we succumb to authorities, how easily we are willing to let go of our privacy, right? So there are several things. I mean, we'll discuss even the Arogya Setu app going forward, and how I think better apps, better ethical data collection needs to happen. But I think the biggest take home is there are multiple Indias. And unfortunately, the biggest India that comes in the political discourse is the India which fights Pakistan. It ends up being the Hindustan Pakistan, right? Or the divisions within the existing India. But the reality is, and the clustering is also dynamic. For example, a migrant UP worker in Maharashtra, when they're being beaten up, they may have a sentiment which is anti-Marathi, right? That we are all from UP and we are being mistreated. But when they are in UP, their treatment may be that I am Brahmin, the other guy is a Dalit. So the clustering of what their identities are, right? When we go outside India, everyone is an Indian. When you return back, when I was in Bengal, they asked me, "Kis desh se ho?" I thought, what kind of asshole? No, it's not a Bengal problem, it's a pan-India problem. You're not from the place, you're an outsider, right? It varies to different degrees. So you have to join different teams. But so pan-India identity is also different when you're outside India. When you're in India, there's class identity, right? So when workers, let's say in Maharashtra, whether they're Marathi workers or immigrants from Bihar, they're all fighting against employer. But when it comes to some other issue, the identity will be different. When it comes to some division, identity will be different. So India is stuck with variants, something which all of us who have lived outside, Dipasri came back recently, less than a year back, she has come back to India. Uh, I'm not saying there are not multiple identities, but in Western Hemisphere, most people do not have as many identities, as many layers, and as many centuries of coexistence. In India, it almost seems like we are having 2000 years which are coexisting next to each other. And in some cases, it's not even 2000, it's sometimes even 60,000. The reason I'm saying 60,000 is Dipasri is working in a region which is a tribal region where some people are still making their living by a lot of collecting, right? So, I mean, they're still in that sort of tribal mode. So India has so many layers. So making policy, discussing, finding solutions for healthcare becomes a challenge. But we as handful collaborators like Dipasri and Sharath, so philosophy that Raamesh, I, and every IonCure go by is we want to bring a holistic change. I mean, we don't know whether we'll even be successful in making 1% change. But we'll continue on with episodes. And the next episode, we'll talk to Sharath about the crisis he's faced in cities, because Sharath is based out of Bangalore. And we'll ask Dipasri to ask him questions because she is informed with a perspective of that with one more episode where we ask Sharath various questions. And bye-bye for this episode. We'll meet again.